Masbate, we have Occidental Mindoro, then we have North Samar, West Samar, East Samar, and then Southern Leyte. So those are the six provinces in the Philippines where we operate. We are here, this island here, and and the typhoon crossed in all the provinces where Plan operates. Actually, when it went through here from the Pacific Ocean, it entered East Samar in Giwan, then struck Tacloban, going up here, going out here. We have a lot. We have 9 sponsored children who died in East Samar.
Oh,
9 sponsored children. One from France also. Sponsors from France. We have not been. We were not able to go out to every single sponsored child because we don't have people right now because they are all out there. So not in the less affected like this one. North Samar was not really very affected by the typhoon. So we know that no one died here. We know already that no sponsored child died here. But we know people died in East Samar. So we focused our, we looked at the sponsored children in East Samar because we know people there died. Here in North Samar, no one died. So we know all the sponsored children are safe. The same in West Samar. We know no one died there in the areas where we work. So we are sure the sponsored children are safe. So we don't have to go house to house. We just did in Eastern Samar because the deaths were just so massive. So we've accounted for already the 9 sponsored children who died. And all the So we want to keep the child, safe from risk of harm, either by sexual, physical, or emotional abuse, exploitation, or neglect. We want to do that. We have a child protection policy in place. That's why we're saying we don't allow unannounced visits. It should always be announced from for example, from France. It should go here. They don't just show up and go to the village directly and look for the child without supervision because it is still our responsibility. That's why we don't allow. So we always say we go to the community accompanied by Plan staff. So we're here accompany you. Children also must not. We don't allow children to go out of the village with the sponsor unless also there is an agreement with the parents and we accompany them. But normally we don't. We think that education is the way for people to get out of poverty. They can go to school and get an education so they can have a better life. So we have a lot of programs that are generally towards keeping children in school, it's education. Because again, we have, like for example, when we did our analysis, there are 25 million school-aged children, and out of the 25 million, 5 million of them are out of school. So we want to change that. We want at least all school-aged children should be in school and finishing their education. So we have education, we have health, programs for health, we have programs for children and youth engagement or child participation, and we have programs for child protection, but including women also. We do programs for early childhood care and development for the young ones, from the small ones. Before they start grade 1 in the elementary, we already have a lot of interventions for smaller children. So that's, we call it early childhood care and development. And in the health component, we do like maternal and child health. We want to keep mothers, especially pregnant and lactating mothers, that they are healthy so that they're able to raise also very good children. So maternal and child health, we do that. Health education, we do a lot of health education sessions with mothers and caregivers, with parents, especially in terms of nutrition. How do you keep their children healthy? So we provide that kind of service. We do a lot of water, sanitation, and hygiene. So we construct water systems and piped water that goes into the village, that kind of thing. So we do that kind of projects also.